drunk. And but it's a chronicle really of abuse, but also of love, and I mean it's not a one-sided deal. And it also describes, I think it's really a portrait, because eventually her mother divorces the father and she goes and grows up in the Dalles, but she grows up poor, so it's a description of poverty and growing up poor in class. And then she goes to spend summers with her dad, who is off the grid in forest camps and living off the land.
Is he sober?
Some of the time.
Yeah, he's
Some
still
of the
not.
time. Some of the time. Anyway, so a few years ago, maybe, I don't know, Kathleen, must be 8, 10 years ago, Kathleen, when I went to re-up my insurance, or Kathleen called me in instead of doing automatic. And she said, Rich, you're paying too much for your Medicare Supplemental. And I said, oh, really? And so she checked it all out. And I think we were going at the time from $180 to $200 a month or something like that. This is for the supplemental. Okay.
You be quiet.
Down here, baby boy.
Yeah. And so she says, well, look at, here's another program you could get for, you could stay below 180, you could get for 170 or something. She said, or you could get the same company and you'd still be 180 if you like this company. But what you'd have to do is cancel the program you got now and then re-up it. And I said, what? So I called and I said, no, let's take the other company. I called this woman and I said, I understand that I could cancel this policy today and buy it back tomorrow for $20 a month cheaper. How does that work? And she said, that's how insurance works.
Well, yeah.
Okay, so I wrote that in a column, and Dave Jensen, who isn't here, but he should be, called me up and he said, that's the most important thing you ever wrote. You just saved me $1,500.
I know. We did.
So anyway,
Okay.
here she goes. Kathleen Bennett, who is knows more about healthcare and more about a lot of things.
Boy, it's a lot of things.
A lot of things. And she has, you know where she gets it? She has this old Catholic nun that she knew from her childhood. And whenever she's confused in life, I don't think she haunts Catholic churches anymore, but whenever she's confused in life, she calls up this nun.
Jane. Sister Jane.
Sister Jane. And she gets straightened out.
I just spent the weekend with her, so I'm telling you, this is going to be. I know most of you, and I want to introduce my colleagues from Hillock Insurance. Haley Hillock, who is my boss, and Savannah Bonifer, who is my associate. Haley's not bossy, but she is my boss. Hi, Irene.
Hi there. Am I too
Hey,
late?
Nancy. No, I'm just. It's good to see you.
We're just
everybody.
warming up.
Oh, good.
Just getting warm. So everything I know, I tried to condense down to 3 pages. So I'm going to touch a little bit on all of the Medicare that probably have you at least concerned or have some questions about. Do you know that, I'm just going to read this because that's just a little bit of trivia. It was originally sponsored, Medicare, A and B, original Medicare, was sponsored by Harry Truman in 1945. Congress ixnayed it. And then years went by, President Kennedy tried again in 1962, Congress denied it. And when Lyndon Johnson was president, he persevered. And Congress approved it, and we need somebody that could make everybody be happy. I think it would be great. Congress approved it, and it was signed into law in 1966. That's not very long ago, 56 years ago. I was hardly, I was still in high school at least. Today, original Medicare is 56 years old and serving more than 60 million people in the United States. That's kind of interesting. Original Medicare, we're going to talk about that. Original Medicare is A and B. Okay, that comes on your red, white, and blue card. That's something that is mutually exclusive from Social Security. You don't have to be on one to have the other. But if you're on Social Security, they will sign you up for Medicare, at which time then you have a choice. If I confuse you, just slow me down. Original Medicare has a deductible. In 2023, next year, the deductible for Part B will be $226. That's $5 less than it is this year. $7 less than it is this year. It also has a premium, and that's $164.90 for 2023, which is down $5 for next year. And we're also going to see a substantial raise in our Social Security. And we should know that within the next 4 or 5 days what that raise is going to be. But you can expect about an 8% increase in your Social Security. So for once, your raises in Social Security aren't being, taken out of your pocketbook by your Part B plan. There's no Medicare A and B covers 80% of your medical costs, and I'm speaking to the choir, to some of you. There's no limit on what just A and B have. So at 80%, if you have a $500,000 surgery or hospital bill, if you don't have something to absorb that 20%, that's yours. And it can be $500,000 or $1 million. There is just no limit on what Medicare A and B cover. They pay 80%, period. And the magic words are medically necessary, medically necessary. They don't cover things like facelifts. They told me they didn't know where to start with me. No, that's not really true. I didn't even, and maybe my eyes, because I still can't see too good. What is covered under A? A is referred to as hospital insurance. So once you're admitted, and we'll talk about admitted versus being observed, admitted covers medically necessary, a semi-private room, your meals, general nursing, services provided directly by the hospital, which includes lab tests, x-rays, drugs, and they also this year have methadone that available if you have an opioid addiction or a problem. So that's available. But they won't cover your Tylenol probably, or warm socks, or the TV. They don't cover that. That's out of your pocket. The services you receive in the hospital from the doctors, the surgeons, the anesthesiologist, as an admitted patient are covered under Part B. So pretty much your hospitalization with A and B, most things are covered at 80%. It's important to note that the outpatient versus inpatient is, I think it's fairly new. I was at the hospital for several years ago, and I don't remember it being an issue. But you must be formally admitted by a doctor to be an inpatient, and if you're under if you are, I don't know what I wrote there. Medicare does not pay for medications that are self-administered, the ones you take at home, if you're just as an out on observation. So you get home and you think that should have been paid, and you get the bill, and Medicare didn't pay for those drugs that you have a prescription for, probably through your prescription drug plan with wherever that is. It's important to ask questions. And if anybody can be your advocate, if you have to be in the hospital, I think that's so important. There needs to be somebody else hearing and asking. There are other services potentially not covered as an outpatient besides those meds. So you want to know. If you're there for more than 24 hours, the hospital is required to tell you what's going to be covered and what's not, and what to expect. But they can keep you up to 24 hours just sort of in limbo. So ask why you're not being admitted, because you want those things covered. Under Plan B, it's also 80% and medically necessary. But, and I will tell you, all of you, are all of you on Medicare? I didn't ask that. You get this book.
Yep, we just
And
got
somebody goes, oh God, this book. But there is a comprehensive list in here of what is covered with under Part B. It's a good book. It's a good book. But some of the things that are acupuncture, but with restrictions. It's how everything is billed. It's how everything is coded. They will pay for up to 12 visits, but it has to be diagnosed and billed as chronic low back pain. And it can't be associated with a surgery or a pregnancy. And if you're on Medicare, I hope that's not the case. It does cover chiropractor, but how they bill it can only be manipulation of the spine. So there's a way to get around a lot of the things that happen with billing. It pays for colonoscopies, so I encourage you, if you haven't, you should. CPAPs, diabetes equipment, flu shots, Hep B shots, pneumonia vaccinations. And they say that I get a lot of questions on why, and anything COVID related is pretty much covered. Shingle shot. That is covered partially with a prescription drug plan, but minimally.
But this Part B is also 80%.
80%. Cataract surgery, you can get it, and you can get a pair of glasses. Kidney dialysis and the supplies that would go with that. And if you have to have a kidney transplant, do you want me to be quiet? I thought you were asking a question.
No, I'm resting my head.
Okay, I think you snored.
I have a question.
Okay, yes, Sharon.
Glasses just a couple months ago after I had cataract surgery.
Did you ask about it?
I didn't know that it was an option.
Yeah.
Okay, well then you should go back to that provider and where you had those, and they will give you a script or whatever and make that, yeah.
That's our problem,
Yeah.
isn't it?
This is what
We don't know, and sometimes providers
we don't know
don't
what
tell
we
us.
don't know.
I
Yeah.
have a question if we go.
Yes, Millie.
The premium that we are going to come down,
Yes.
was that in the bill in the beginning? Have people always paid a premium?
Yes. Well, no, I don't know the answer to that. In fact, I tried to find
Only
out
my mother
today how long it was in force before they could sign up for it. And before 1966, our mothers, our grandparents, they didn't have medical coverage. So I don't know the answer to that, Millie.
Lock it up.
Yeah. So that'd be a good question to know.
Would therapeutic massage be covered?
No. They don't even give you wiggle room with massage. It just is not covered. They give you some outs here with how it could be billed in order to receive the service, but so and it has to be medically necessary. So it could be one of those things that you could appeal to Medicare and see if there isn't some way you could get that to happen.
Have a doctor refer you?
That's right. But if they're not paying for it, you should probably write a letter to Medicare with your doctor's blessing, or maybe even have that doctor write a letter. I just think there's a way around pretty much everything.
What does medically necessary mean? Medically necessary to not.
Means you don't die.
Medically necessary to not die or to get better, or
Those are two very different things.
Okay, well you explain them to me.
Okay, well, medically necessary could mean just that's a very, that's a term that I don't know what's meant by that, I guess.
Okay, that is a term used by Medicare, so they define it. They define it, and it's fairly arbitrary when it comes to taking a look at. Judy gave me permission to just mention that, you know, she had a stint or a stay as an inpatient for a few days. Anybody that knows her was pretty happy to see her dancing Saturday night, though. So I would think not medically necessary might be if they rubbed your feet. I don't know what's
Or cosmetics.
or cosmetics. I think it depends. The whole thing with Medicare is like a piece of a puzzle. So Nancy comes in and we have this conversation, and she is this and this and this, but she doesn't want this and this and this. So we find the product that fits what she needs. So medically necessary needs to fall in that somehow, but the definition is Medicare's. It's not something that the hospitals or the doctors, but Medicare will tell them that wasn't medically necessary.
Well, don't they often, if a doctor prescribes something, say a doctor tells me to go get my varicose vein stripped, then they do an exam, and that doctor has to go to Medicare and say, is this okay? Is this medically necessary?
Not always.
But I got turned down one time that way.
Well, yeah, and it would have depended on the diagnosis.
Okay.
And, I mean, that's very, very important. So
Okay.
that doctor had to indicate
Okay,
that
the necessity.
it was necessary.
Okay.
You know, I mean, for well-being, for the
Yeah, yeah.
health, for bleeding to death. Nance.
But often,
I think one that I think of that sort of is clear is, like, you can get your cataracts done and they'll pay for the minimum lens. But if you want to upgrade to one of the better lenses that also corrects your vision, and you've been wearing glasses for years and years, Medicare doesn't pay for that upgrade because they say cataract surgery is medically necessary. That improvement, added benefit of the improvement in your vision, well, that's not so medically necessary. You're going to live without it. You
Right.
wear glasses, but you live.
But you
So
might-
I think that's kind of how
It's pretty vague. It's pretty vague, and I think that's a really good question because you're not going to die with not having your cataracts removed, but you might get run over.
You're gonna get worse and worse. I think if you get worse and worse and worse without fixing it, like a gallbladder, you just get sicker and sicker. You don't
Yeah.
die, but you just get worse.
Right. And they're going to. I mean, really, it's a pretty generous program. It's pretty generous. Sharon.
Well, we just talked about this recently. I had cataract surgery with the basic lens. I'm super happy. I had that done this spring. Now my husband's having some trouble with his hearing. They don't cover that.
Right,
But,
which
you
is
know, it's
stupid.
okay to have your eyes fixed, but it doesn't matter if you don't hear. I mean,
That's right. They don't
who
care.
decides
That's all Congress has to get their act together, and I mean, dental's not covered, and 80% of my clientele need to go to the dentist,
yeah,
and
But it's-
and who can afford dentists? Judy.
it's the lobbying of the dentist and the audiologist.
And I'm happy you used the word medically necessary, because I couldn't think of that word. But when I first had all this jaw stuff way before this summer, I knew I couldn't afford it but there was infection going up here into what local doctors thought could be my brain. I better get this taken care of. Unfortunately, I didn't go to Kathleen about it because I do not understand my insurance agent's jobs. But now I'm better. Anyway, we wrote doctors from Wallowa County and dentists to Medicare 3 times.
And you were turned down.
And turned down, denied because of it wasn't medically necessary. But I could not figure that out, and neither could Dr. Malley, several people.
Right.
But I don't know, the letter was very short, it wasn't mean. It just said denied. So what are you gonna do if you have to have it done and it won't cover it?
So, okay, Judy, that's something we should talk about. Because I don't think there's any statute of limitations on something like that. When did you have your first surgeries with your jaw? What year was that?
2018.
Okay, all right, so.
Well, we don't have to do it right now. I just was thinking to myself, how they define medically necessary. We do not.
Okay,
That's what you're saying.
yes, we don't define it.
No.
We
But you
don't
can't
say.
appeal is what you're
But
saying.
you have, there's an appeal process, and I think it's worthy.
I think it's good for you to check your coding. You can ask the doctor, what code did you put on it, like you said?
Yes,
I-
coding
Oh,
is,
yes.
Because I used to code, and there are these general parameters for coding. You know, if you're coding fast, somebody has an earache. But there, in the book, there's a whole series of types of earaches. One earache can actually cause brain damage if it gets too far in there, there's an infection. And so if the doctor doesn't define into the finer definitions, like the one that would have gone closer to your brain.
yeah, I think Judy, I
If
shouldn't.
they don't put those little numbers in there, they won't do anything.
I know that the coding has changed a lot in the last 10 years. It went from like 4,000 or 5,000 codes to like 45,000 codes.
Whoa.
Yeah,
It's a
you get more
huge,
and more
it's a
defined.
huge job. So like Millie says, for everything there are codes. So my God, I don't know how anybody could figure that out. You think Medicare's confusing, but I'll tell you who is a rock star is Malia Bacon at the hospital. I mean, she is willing to listen and make changes, and I talked to her 3 times yesterday. So that's part of what I do is to try to advocate. I try to advocate and as the best I can.
If the infection is in your jaw, it's a certain code. If it goes to the mastoid, it's another code. If it goes closer up your nose, it's another code. But often a coder, when they just go to your doctor, the doctor writes down jaw. They'll just use the first code.
That's right. The
Because
easy
the doctor is
doctors aren't coders.
They're not
They're
coders.
not coders.
They're not coders.
So you have to
That's
cut
good
a
job.
jaw.
Okay, so I wanted everybody to give me their email address. So if there's something that I'm not addressing here and you have a question, I'd be happy to research it for you and to do that. So I'm going to continue. I have to answer Ralph.
Are you saying that all classes are covered now, or just if you've had cataract surgery?
Just cataract surgery related. If you're on just Medicare.
Yeah.
Now, we're going to talk briefly about Medicare Advantage, and I know that you open enrollment, open season on old people, I refer to it. Starts the 15th of October, ends December 7th. And you can do 2 things. It's for Medicare Advantage product, I'm going to tell you about that briefly, and your prescription drug plan. And anything you see on your TV, ignore it. It isn't here. We have one Medicare Advantage plan. It's owned by MODA. What am I trying to say? It's covered by Summit. And there are reasons to be on a Medicare Advantage plan, and there are reasons not to be. So I'm just going to cover that. It's a Medicare offers the plan, and it's what's the word I'm trying to say, you guys? It's
Supplement?
there's a prize here if you give me the right word. It's offered by Medicare and Medicare approved private companies that must follow all the Medicare rules. So you get all of the benefits of A and B plus a few extra. But you also have a lot of out-of-pocket cost. But it does have a ceiling. It does have a limit. So you don't lose the farm. So that's one of the reasons to do it. Some of the plans include drug coverage, and I jumped right over Medicare and A and B, and I went to Medicare Advantage. Most have in-network and out-of-network providers. If you go out of network, you can expect to pay a higher cost for services unless it's an emergency. Medicare pays Summit a fixed amount every month. Wallowa County has one. It's Summit Health, owned by MODA. You must live in the plan area of your Medicare Advantage plan. Moving out of the area provides a qualifying event, and you can switch plans. You have 63 days. If you moved from Portland and you were on Providence and you came here, you have 63 days to you can either go to a Medicare supplement, you can go back to original Medicare, you can get a new Medicare Advantage. Yes.
So is the hospital and the physicians in Wallowa County, are they part of Summit's,
Network, in network. And yes, they are.
where's the nearest Summit facility?
Well, there's no Summit facility. They're all contracted. They act like the Medicare.
Yeah.
You know, they do contracts with all of these providers.
Oh,
And it's a huge in-network. You can see doctors in Boise, Walla Walla. It's a big network.
But the premium goes way up, or,
No,
that's what I'm,
I'll tell you about that.
Can you choose your doctor? And I mean,
Yes.
if they're in the network.
Yeah, but it's a huge network.
Well,
Nancy,
Yeah, they're all in, all the local doctors are in the
yeah,
network,
but a lot of
plus
us, I wouldn't have
most
surgery here,
specialists
sorry.
in the region.
I couldn't have surgery here or in Walla Walla.
well, you know what? Those are personal choices, Sharon. And I think that there are enough other choices with the Medicare Advantage, because you can go to Boise, you can go to Tri-Cities, you can go to Clarkston, you could go. I mean, it's a big in-network. It's a big in-network.
Even Spokane is.
Spokane is as well. Yep,
Seattle or no, is that too far?
that's too far. Seattle's not, so that would be your cost. But your A and B would cover 80% of it. Medicare Advantage plans offer some extra benefits. So there's you get, I think, up to $500 a year for dental, and you can get your teeth cleaned.
only 500?
But you can get the preventive. It's all about preventive. You can get your teeth cleaned. You can go get your hearing checked.
They also discount like a crown. I paid $700 for a crown instead of $1,200.
See, and that's the individual dentists will do that. Well, so 700 instead of 1,200, isn't that 500?
But I also had 2 cleanings.
Those are preventive, so there's no cost. Okay, here I go. I want to talk to you. I think we talked about acupuncture. I should have numbered these pages. Before I move, I'm going to just talk a little bit at the end, if we have a few minutes, about what's covered under Medicare Advantage. And Sharon, we have an appointment to hone in on
What
you.
if you're traveling?
Pardon me?
What if you're traveling?
You're screwed.
So Kathleen,
Don't travel.
got Medicare Advantage, and I'm on whatever it's called Plan and Supplement now.
You're where you need to be. That's Judy was on a Plan N. How much did you have to pay
For this last.
for the
54
last
days?
thing?
80% or?
No, I will tell you, Kathleen, actually, see, now I'm understanding what an agent does. It took me, how old am I now? 15 years or something. I didn't never know to call her, but she called me in the hospital my last of my 54 days and said to me the best thing anyone said to me during this horrible experience, and that was, do not pay 1 penny. What you have, now you're gonna still have to cover from the neck up, but what you have is covered by Medicare and your supplemental, and if people give you trouble about this, you send them to me. And truly, I got bills from the Lifeflight, from the ambulances, all that was covered. And I did not know that. I was worried in the hospital about whether or not I could breathe on my own again and how I'm gonna pay probably $150,000 or more worth of bills.
That's about your air life.
Yeah, but anyway, it was a great thing to learn, and I do not have Medicare Advantage. Kathleen, when I go to her every year during Old People's Month, she tells me, because my biggest concern is how much I have to pay every month for the premium, my supplemental, because I live paycheck to paycheck. And she tells me, she says, I've figured out one for you. This one will be good for you, and you'll come down $20. And this is still all covered. And that has been a great gift. It has, Kathleen. I really, truly rely on you.
Oh, honey, thank you.
No, not because I want to compliment you, but because you helped me.
So Kathleen, can you distinguish between, okay, that's Plan N, between Medicare Advantage and supplementals?
Yeah.
And what,
Okay, two very distinct, different things.
pardon?
They're very different.
Yeah, and what's the different in cost and the different in coverage?
Okay, the difference in coverage, if you have a Medicare supplement, Judy has an N. So her, and I think Ralph does, and so does Richard. So if you have a supplement, that picks up the 20% that you're not covered, that Medicare doesn't cover, with a couple of exceptions. A Plan G supplement, and all of these plans are standardized. A Plan G supplement covers the 20%, except you pay the Part B premium and the Part B deductible. So, Randy.
Point of clarification, if you had a job that provided health insurance like a federal job, and so then you carried your federal health insurance into retirement, that then when you become eligible for Medicare becomes your supplement, and it pays the 20%, so it's like a supplement?
Right, and depending on what the plan is, Randy, you may not even need to get a supplement. I mean,
That could suffice for your
yes,
supplement.
if it's
It's not what you were talking about with an N or a G or anything, it's different.
there are supplemental plans throughout the United States, and there are 100 different companies that sell these plans, and basically that's how I make my money, is selling them. So I'm an insurance agent, so I guess that should have probably been disclosed to start out with.
Okay, so you're saying if you have Medicare, you can also get a Medicare supplement, are you saying?
Yeah.
You don't have to have another insurance supplement.
No, you.
Well, it's not
Okay,
through Medicare, it's through a private insurance.
But the supplement, see, now this is where it kind of all goes like this.
Does it cost about the same
The-
as a
the-
regular supplement?
A regular supplement is, you have an N and a G. Those are your choices. And an N is probably the least amount of premium. A G gives you a little more coverage because you just pay the deductible. And for all of this, you have to pay your Part B premium,
Yeah,
which is
which is the one that's deducted out of your Social Security.
Yeah. So let me tell you about, I think this is illegal, so don't tell on me. I might go to jail. Bring me cigarettes. I'm going to start smoking if I go to jail. Virginia Slims. Remember them? I'm kidding about the smoking part. But these are the plans. There are 4 plans that Summit offers. One does not have prescription drug coverage, and this year it's $19 a month for the next calendar year.
That is a supplement.
This is a Medicare Advantage, and I'm going to just send it around and take a look at them,
Sorry.
and then if you have questions, you ask me. So if you do, the most expensive plan is $139 a month, and it has prescription drug coverage, but it also has a maximum out of pocket. Do you understand what that means? You pay a copay until this dollar amount of $4,850. And that's what Judy was talking about. She didn't want the nickel and dime. If you can afford to pay the copays and it's not, it's not uncomfortable, or you get to $4,850 on that plan, they pick you up at 100%. But unless you're very ill, most people never make it to the $4,850. But you do have co-pays pretty much for everything that isn't preventive. I'm just going to pass them. There's 3 pages. Don't let anybody take one. And then if you want to talk to me about that, if you want to talk about it, I can't talk about it until the 15th, which is Saturday. That's a law.
Okay.
Whoa.
Of October, and on the 7th of December, you've used up all your fun tickets.
So, address a couple of things specific. So, we talked about Lifeflight. So, where is that covered? Is that covered on Medicare, on Supplemental, where is that covered?
It is. There is no real reason to pay for Air Life if you have Medicare, original Medicare, and a supplement.
Okay.
They will cover. Medicare covers 80%. Your supplement covers 20%. I promote buying the coverage. It's $100 a year, and we need them here. It's, if nothing else, it's to support it. You don't need it if you're on Medicare.
Okay.
You don't need it.
Now, you mentioned, and Nancy mentioned the dental. So, which of those NGs, Advantage, whatever?
Medicare Advantage is the only one that offers you any kind of dental.
Okay.
Medicare Advantage. And
So, do you get Medicare Advantage plus other type? Plus and?
no, one or the other.
But if they call him on the phone and say, I'm Medicare Advantage, we'd like to take advantage of this, and you say, my zip code is 97846, sorry, you don't have it.
No, it's ignore everything that they do. We have one plan. One company, 4 plans, and they're going to show you.
So
Judy.
you have to go to someone like you to get it, not on
Ye-
the phone.
Oh, you might be able to get it on the phone.
You can't, the
But-
minute you give them your zip code, they say, no, we don't code it.
You have to get Summit, and you could probably call Summit, but it'd be better if you came to see me. No.
Kathleen, why didn't you recommend to me Medicare Advantage?
Because you didn't want to be nickel and dimed every time you went to.
Is this the $4,000 one?
Yes,
Oh, the deductible.
and it's not, you're not paying a heck of a lot more than $149 a month, and you have basically 100% coverage. And you have $20 copay and your deductible. And your copay is just free. Yeah, I wouldn't go on it myself.
All those years that we paid into Medicare, where does that money go if we have to pay a premium? I don't get it.
Call them up and then tell me.
Make me pay a premium. when
And
I
here,
paid
get
all those
this,
years.
get this. If you make $100,000 a year and you're single, in that neighborhood, or $200,000 and you're married and filed jointly, you pay more for premium and deductible.
Good.
And
So
I go,
correct.
oh, I'm so sorry.
But we really don't know where that money went then.
No,
Millie,
Medicare,
Paid in
It's-
all these years.
there isn't enough money
The
in
old
there,
people cost a lot of money.
Millie.
You
So
think
we
about
have to
it's,
pay.
Yeah.
it's not unlike how the Affordable Care Plan started. President Obama wanted everybody to sign up for it so that the well people would take care, it would spread the pain, the cost. And those people that were well said, no, we're not signing up for it. We're well, we're not. So that went away. But it's still the same theory. It's basically the same thing. It spreads the pain. Because, we've all had things happen, and Medicare is pretty darn generous. And so I think we'd be really up a creek without it. Don't travel overseas. No, I'm just kidding.
Unless you get travel insurance.
Travel
health
insurance, but
Travel
I've just
health
had a
insurance.
client that was hospitalized a year ago, and we have spent a year trying to get him some reimbursement for that, because supposedly on the plan it says he would get 80% of medically necessary, defined by Medicare, coverage, and he has a deductible. So finally, after a year, he's going to get about a third of what the actual cost was. But I spent hours.
Travel to countries with good socialized medicine.
He was in Germany.
Oh,
Oh, wow.
neat. Well, they pay in Turkey.
They won't pay anything if you're in a third world country. Mexico, no. No. There's no, this is just some random things that I just thought to add. There's no official hospice in Wallowa County, but the hospital and the clinics do have traveling nurses. Am I needing to quit?
No.
Visiting nurses that they send out, and there's some way they've worked around those designations to get that covered, to get hospice services for people that need it in our county. Some people, by virtue of income, qualify to be dual eligible, and you've heard that. And that would be someone that gets Medicare and Medicaid. And so, and that's DHS, Department of Human Services, the state of Oregon, come in and pick up some of the costs for the premiums and that sort of thing. And if you're absolutely indigent, you get it covered at 100%. So, I mean, there's a lot of care. There's a lot of ways to make things happen. Medicare is nationwide, United States nationwide, and you can see any doctor, any place you want. You don't need to call ahead for a referral unless they request it, but it has to be medically necessary. And if they accept Medicare, you can go to them. And because we're all getting older, most of us, most everybody is a Medicare, accepts their contract. All providers do. I just don't run into anybody hardly that doesn't.
Well, suppose you find someone who doesn't bill Medicare, who won't bill Medicare directly. Is there a claim process?
There is a claims process. Yes, there is. But they would not pay you they would pay a portion of it, and that's something that you would have to get. There is some money, but you'll get reimbursed some. You have to pay that provider. And I see that with dermatologists, with some real very specialized providers. Sharon.
Well, I had noticed something that I found disturbing. This is why I've been not sure about continuing with the supplemental, is that first of all, Medicare talks down the doctors or surgeons way down on the price. That I see.
Oh, yeah, they do.
Again. And it's really quite reduced. Sometimes it's only about a quarter of what the doctors were asking.
Mm-hmm.
And then by the time it gets around to 20% to the supplemental, they pay, $15 or something.
They pay what Medicare, the 20% of that charge that Medicare didn't.
Right, yeah, which is practically nothing most of the time.
Well,
Even with
depends.
cataract
It's
surgery,
20% of whatever.
vascular surgery, they paid almost nothing,
Did you pay anything?
$25.
See, I doubt that you shouldn't have even probably paid that. You have a deductible, so it's not up to us. Here I am preaching to the choir. It's not up to us. Those doctors make their, do their deal with the devil with Medicare, and we're here. We pay. We need help. It's socialized medicine, and there's nothing wrong with that. We need more of that instead of less of that. That's my opinion. No, won't cost you a thing for me to do that.
Often if you let's say you go to Bend.
Go to bed?
Bend.
Oh, Bend.
And you're doing something with the doctors. In most of those doctors' offices, they have a disclaimer that says, okay, well, you have to pay for whatever is not included. But with Medicare, I've never had a bill, but they won't treat you unless you sign that thing.
Yeah, that's called a something. I marked that.
So, I mean, we know that Medicare reduces it for a lot of.
They do, they
But
break
that
it
doesn't
down.
necessarily mean you're gonna have to cover the piece that they.
Nope,
You're just guaranteeing that you will, but then your supplemental is probably paying that.
I'm just gonna tell you what it
20%.
says. See, this is a great
What is
book. It's called Advanced Beneficiary Notice of Non-Coverage, or an ABN. If you have original Medicare without a supplement, your doctor or other healthcare provider may give you a written notice if they think Medicare won't pay for the items or services. So it's not that they know they won't, it's just that if they think they won't.
Well,
This-
I had a supplement, I just couldn't figure out why they wanted me to.
Yeah,
sign-
well,
to
they,
sign something.
because they make everybody sign them.
That's what I thought.
Yep.
They won't
Yep.
like me if you don't sign it, but that doesn't mean you're ever gonna get a bill.
That is
No,
correct.
it's just
Okay,
your
that's
guarantee.
fine.
And so if you get a bill and you have a supplement, you need to come and see me so I can advocate. So,
So
we're gonna
Kathleen,
wrap this up.
but when Truman tried to pass this stuff, the AMA fought it.
Yes, they did. The doctors
Okay.
didn't want it.
When Johnson passed it, the dentists fought it and stayed out. Okay?
And they've been more successful.
And they've been more successful. The audiologists fought them. Okay?
There's huge
And
lobbies, the
And
lobbies.
the optometrists fought it. okay.
Ophthalmologists.
Oh, the well, they do the surgery. So
Right, so they're the ones who fought it, because optometrists, well, no, that's right.
Anyway,
Anyway,
so
that was
now it
close.
looks like we've got new legislation this month that's gonna change the landscape on hearing devices.
Yes, we're gonna be
Okay.
able to go over the counter.
So is there softening on dental and on,
It's at least being discussed,
Okay.
and I watched closely in the last
Yeah.
6 months when Congress was actually talking about it, that dental is half of the people on Medicare need dental service, and they're not getting it unless they're on Medicare Advantage.
I wish someone would invent a new name for medical insurance after you're elderly or if you're sick with something terrible that you can't work, okay? Not just say that's socialized medicine. Because other countries, like when I lived in Scotland, they had socialized medicine for everybody if you wanted it.
Right.
And they had private medicine if you chose to go pay for it. So that's more like us, where
Right.
you have two insurances in the world, and you could go this way or that way. Well, it's not true. In Scotland, a lot of people just do this, everybody's eligible for the social stuff, but we're not in this country. We're not eligible for anything social till we get 65. So they
Unless
should-
you're deemed dual eligible, I
Unless-
mean,
unless
Oregon
you're
Health
real
Plan.
sick with as an invalid or something, but then even Medicaid pays for that. So they should
Yeah, Medicaid is a
they should
big
not
deal in
call it
Oregon.
socialized medicine, because socialized means you don't
Are
have
you
a
making
choice.
a list? Because you need to get on a couple of things. You find out where all that money goes that Medicare's been charging. And then how do we change the name?
Well, I don't
and
know,
it's
but
a
I
thought
take it
process,
in
isn't
the-
it?
In the political world, when they say that, we're all socialized in America,
yeah,
we're all gonna
that's
die as
terminology.
communists, when all we're doing is taking care of a few old people.
I know. So I'm going to tell you, you can talk about a new prescription drug plan beginning the 15th of October. And if you're on meds, you should probably shop it. If you're not on meds and you're not on a prescription drug plan, and you should be, probably, Medicare has been assessing you a penalty from the time you were first eligible until,
yeah.
anyway, that whatever that penalty is 1% a month of what the national premium average is. They assess that penalty, and then that's added to your premium that will stay with you till you die. So even people that come to me and say, I don't take a pill, I need nothing, you need the least expensive plan, because at 65 you may not need medicine, but eventually you will. That's
And-
not very nice.
And so you should shop that during this period.
Absolutely.
Should you also shop Plan N every year?
That's your birthday month. That's, I said, that's where this gets a little wonky.
Okay. But we should again shop it every year?
Mm-hmm,
Okay.
absolutely,
Okay.
absolutely.
What do you mean by shop it? I mean, where do we?
So if you're on a Plan N, you can come in during your birthday months, with, I think your birthday is in October, isn't it? You should come in, and then we can compare all of those Plan N plans and see if I can find you a less expensive one. And we can do a lateral move. You don't lose any benefits, nothing. We just hopefully save you some money. But that's during your birthday month. So you have the day of your birthday going forward 30 days.
What's the difference on the October 15th rule?
Okay, October 15th is open enrollment for Medicare Advantage and prescription drug plan. It has nothing to do with supplement.
Okay.
Judy, hang on. Hang on.
I was just gonna say, and probably all of you know this already, but I tried doing this without a Kathleen. I mean, I'm just telling you, it just was befuddling to figure out what all this is. I actually was also under the impression that when I got old, Medicare was gonna cover my medical and I wouldn't have to worry about medical insurance. But I did not know that every month when my Social Security comes, there is a chunk of money always taken out for the benefit. And then I pay for my supplemental, which is the second thing because I wanna have a supplemental. And I pay for a prescription drug benefit. And so every month I'm paying.
And you pay the premium for your Plan N.
That's right.
And I am getting wealthy.
Good. You are not. But I'm saying to those people that don't know this, that even though you think you're not gonna buy insurance, you are paying $350 to $400 a month
Right.
for whatever we get
Whatever we
this
get.
way.
Yeah.
And it is I'm grateful because I don't have to pay $1,500 a month, but I didn't
Yeah.
know. So when you say shop, I can't do that by myself.
Okay, but you can come in.
I'll come in.
Sharon.
Having to do with Humana or, prescription drug plan, due to an error that first year, I got delayed and didn't sign up until a few months late. And, I pay extra.
How
every
much
month.
extra is yours, Sharon? It's,
Somewhere between $3 and $5.
mm-hmm.
And, so if I were to go off of that, cause I have paid quite a bit more by paying to Humana and then also buying, hormone replacements,
Mm-hmm.
which I know how much it cost before I had Humana, cause I was buying it through Safeway. And so I'm paying quite a bit more total. If I were to go off Humana for a period of time, would the extra that I would have to pay go up? And by like so much per year? And
It's
how much?
the national premium average in the United States for 2022, I think, is $35. So they take 1% of that, which is 35 cents. Is that right?
$3.50?
Yeah.
1%?
35 cents. And they start that every month that you don't have a prescription drug plan, that 35 cents is, you're fined that. If you never sign up for a prescription drug plan, you don't have to pay it. The minute you sign up for another plan, that has all been accumulating and it goes to the top of that plan and it stays with you till you die. So, but if you,
$35 a month as if for 2022, the penalty was 35 cents per month that you don't have
right,
prescription coverage. Oh.
I was only late a few months signing up,
and it was $3?
yeah, it's about $3 a month.
Yeah, that shouldn't have been. I mean, we talked about it. What you bring that stuff in and we'll talk. Okay?
Then, going back to a question or a comment earlier, it had to do, I've been paying for the Lifeflight thing in the 2-year increments for 20 years. And still paying for it, and I'm 70 now.
Congratulations.
But, I don't need to pay for that, so I don't need to
You don't have to pay for it.
But
But if we want them to stay here.
But I want them to stay here, and if I can afford to pay for it, I will.
I'm paying for my daughter and her family, so in
Again, that is an absolute personal choice. I am an advocate for it because I know people who are alive today because they flew in here, and but you don't have to.
But we need a critical mass. What you're saying is we need a critical mass of people paying that premium.
Yeah, yeah. But we don't have to.
I
I'm just-
remember, Kathleen, when Liam had cancer stuff 10
Mhm.
years ago.
Mm-hmm.
There was, for the life of me, I couldn't get his primary to pay, you know, they would say, well, we didn't receive a bill, we didn't do this, we did. And then you go to the place, the medical office, and they'd say, oh yeah, we sent it. And it went on like this for a year, and I finally had to get the healthcare people, I said, I want a conference call between you, the healthcare provider, and this building office. So they gave us a conference, and she said, I said, a year, you've been telling me for a year, this medical office, that you've sent the bills. The primary's telling me they never got them. So I want you to tell her on the phone that you sent them and these people never got them and whatever. And the two of them had to talk. That was the only way I could get anything done. It was incredible to me. And finally they said, well, there's been a problem, then we really, you know, obviously you're right, I'm right, you know. But what we want to do now, how can we sort it out? And I said, I want you, the billing office, to fax the bill right now on the phone to this Medicare provider. And I'm not getting off the phone till you fax it.
Good girl.
And the lady said, okay, so she faxed it, and I said to the primary guy, did you get that bill? And she said, that's what I had to do. It took a year.
See, that's pretty
That's
extreme.
why you are so wonderful.
I do deal with that, but you know, I
couldn't believe it.
yeah, I have ways. They don't want me to come up. It's just you know, we talk about in, you know, general terms all of these things with Medicare and Medicare Advantage and prescription drug plans and A and B, and it's overwhelming at best. But I am happy that it's here. If I can answer any questions for you, I have the support from my boss, my employer. I do advocating, and I'll help you. It costs nothing. So there's that. So, and I'm happy to do that. And if you want to shop, you can shop. And Irene, you need to come and see me.
And you're not retiring soon, now.
What the heck?
Did you say your birthday month, or when Ralph asked, I thought you said 30 days from your birthday date?
Yes. So that's what Oregon considers your birthday month.
Oh, okay.
So I'm sorry. So the Halloween, your birthday's Halloween, goes forward to the 30th of November.
Okay.
Or the 1st of December, actually.
maybe you forget, she'll post-date the application.
Don't be saying things like that. I'm going to be so in jail. But I smoke, what did I say?
Virginia Slim.
Yep, that's it.
Remember.
I don't remember. Any other questions? I'm sure I've left big gaps in things that you want to know. Good.
So I understand if you have Medicare A and B and you have a secondary insurance through your employer or whatever that you carried out,
Mm-hmm.
is that generally better to stay with that than to drop your
It's about-
insurance and go to one of these like Advantage or something?
Yeah, I'm not a huge fan of Advantage, but I know people that are, so it's available, and I should be, and they're getting better. But if your coverage is as good as what you would have if you went to original Medicare and you got a supplement, and you have prescription drug coverage, there is no reason to switch. You don't have to.
So I'm not getting penalized.
Nope,
for
you're
the
not.
drug
Nope.
because it covers.
It's when you go bare, when you go without anything.
Okay.
Kathleen, did you say when you first started, and I was thinking about these guys, with your federal, whatever.
That's great.
Anyway, did you say, or did I mishear you? You can have Social Security without any medical. Like, they don't have to take that $149 out of your check if you have coverage. Is that correct?
Well, that is true. That is true. But if you haven't signed up for Part B, then they're not taking that out.
I have.
You have. You did sign up for it, even if you didn't need to.
See,
You have to.
You have to?
You have to.
They require
They
that
require
you do
it.
it. Okay. All right. Some places don't require it. I screw up your camera. Sorry, I stepped on it. Just send Haley a bill.
That one's okay.
So there are a couple routes there. So that heavy duty employer insurance, the great plan that paid for your dental and your eyes and your brain surgery and everything. If it continues until the day you die, okay, you just keep it and don't do the Medicare at all.
That is correct.
If you worked for the Enterprise School District when I was on the board, okay, we encouraged early retirement so we could hire cheaper teachers,
Right.
right?
Of course.
And we said we would pay your insurance premium for X years. So again, that person could go until they got to,
Until they didn't have that coverage.
until they didn't have that coverage.
Right.
Okay, then you've also got employer coverage, which is not as good, doesn't cover everything. Can that be used as your supplemental and pick up the 20%?
No.
Okay,
No.
it's either
And
on
that's
or off.
yeah. Yes.
The switch is on
And
or
you
off.
have to be on A and B to get a supplemental.
Okay.
You have to be on A and B to get a Medicare Advantage. You have to be on the original Medicare. And if the system requires it, you have to anyway. But you can maintain that. Are you paying premiums?
Yes.
So that would be the question. Would it be to compare the plans, to compare the coverage, and to compare the
And
prices?
to compare the premiums and coverage. Well, it is a jigsaw puzzle, and you are the puzzle master.
Well, I hope I didn't make it more confusing. Did I make
No.
it more confusing?
No.
Okay.
Yeah, it's very.
Clear as mud, huh? That's what I said.
Uh.
Yeah. I appreciate everybody coming. I love what I do. I am blessed that I have amazing women I get to work with and an amazing boss that isn't saying I'm too old. So, well, I'm too old for some things, but
Yeah. Well,
but
ain't we all?
yeah, yes. So, hi, girls.
Thank you very much.
Thank you.
We'll all be in to see you.
Okay.
Susanna, you're going to have to be busy making appointments.
I will be,
Yeah.
You know what they've been doing is claims filed from the tornado in Wallowa.
Oh.
They have I think you fielded well over 200 claims in just a very